Hi everyone, my name is Irish Innumerable and we are teammates. We will be discussing mental health issues related to substance abuse. To start, what is mental health? According to the Canadian Mental Health Association or CMHA, it is a state of well-being in which the person realizes his or her own abilities. They can cope with stress in life, they can work productively, and they are able to contribute something to the community. Next, what is mental illness? CMHA defined it as a recognized, medically diagnosable illness that results in the impairment of a person's cognitive, affective, or relational abilities. This can result from biological, developmental, or psychosocial factors and can be managed using the same approaches applied to physical disease. Let's go to the definition of substance abuse. This refers to the harmful use of psychoactive substances, such as alcohol and illicit drugs. Regular use of these substances can lead to dependence syndrome. Moving forward, I will discuss the relationship between mental health issues and substance abuse. According to the National Institute on Drug Abuse, many individuals who develop substance use disorders are also diagnosed with mental disorders and vice versa. Mental illnesses can add to substance use problems. It is commonly known that people with severe, mild, or even subclinical mental disorders may use drugs as a form of self-medication to reduce anxiety, depression, sleep problems, tensions, hallucinations, and the side effects of medicines. For example, a person who has anxiety disorder may use a short-term anti-anxiety medication that wasn't prescribed, which can increase the risk of dependence. In another way, substance use can lead to changes in some areas of the brain that are damaged in other mental disorders. While using these drugs or alcohol, individuals may feel better for a short while, but their mental health issues can be worsened with the regular use of these substances. Several drugs can cause short-term symptoms of psychosis and may lead to long-lasting symptoms in some people.
Hi, my name is Tenzin Rinzin from Team 8. I'm going to tell the statistics of substance use disorder in Canada. But first, these are the most common drug used in Canada. The number one is cannabis, and the cocaine, methamphetamine, ecstasy, and heroin. The highest economic cost of substance associated to Canadian is alcohol, which costs 14.6 billion, and then tobacco, which costs 12 billion, and opioid 3.5 billion, and cannabis costs 2.8 billion. So, who is affected? Young people aged 15 to 24 are more likely to experience substance use disorder than any other age group. And then the men are higher rate of addiction than women, and people with mental illness, they are twice as likely to have a substance use problem, and the homeless people and the people with the chronic pain. Prevalence, this is the number of disease cases in Canada. In any given year, 1 in 5 Canadians experience addiction problem, and by the time Canadians reach 40 years of age, 1 in 2 have had a mental illness, and 52% of Canadian male had used cannabis, and 83% of Ontario students in grade 12 drink alcohol. So this is the morbidity and mortality rates. People with substance use disorder are more likely to die prematurely than the general population. And in Ontario itself, substance use disorder case is 1.5 times higher than all the cancer put together, and more than 7 times than all the infectious disease. Tobacco is the leading causes of premature mortality in Canada. Smoking is responsible for nearly 70% of all death, and among Ontario aged 22 to 34, one of every 8 deaths is related to opiate use. So that's all about the statistic. Thank you.
Hello everyone, I'm Myla Revelo and I'll be discussing the causes and risk factors as well as the manifestations. Causes and risk factors include genetic factors, how drugs interact with the brain, environment, mental health issues, and coping with thoughts and feelings. Genetic factors is where some people may inherit a vulnerability to the addictive properties of drugs, while how drugs interact with the brain is where people use alcohol and other drugs because they stimulate the brain in ways that they will feel good. While in the environment, people's home and community and the attitude of their peers, family and culture toward substance abuse can influence whether or not they develop substance use problems. Mental health issue. More than 50% of people with substance use disorder have also had mental health problems at some point during their lifetime. And lastly, coping with thoughts and feelings is where people may turn to substance as a way of coping with difficult emotions or situations. They start to rely on substances to regulate their emotions. Risk factors for substance use problems in youth include alcohol or other drug problems among family members, poor school performance, poverty, family conflicts, chaos or stress, having friends who drink or use drugs, not fitting in socially or being excluded, emotional, physical, or sexual abuse, and experiencing discrimination or oppression. The protective factors for substance use problems include having a positive adult role model, having a strong attachment to family, school, and community, having goals and dreams, and being involved in meaningful, well-supervised activities such as sports and volunteer work. The manifestations. Symptoms of substance use disorder are grouped into four categories. They are the impaired control, social problems, risky use, and drug effects. Impaired control is a craving or strong urge to use the substance, desire or failed attempts to cut down or control the use of substance use. While social problems is where substance use causes failure to complete major tasks at work, school, or home, socially work or leisure activities are given up or cut back because of substance use. In risky use, the substance is used in risky settings, continued use despite known problems, while the drug effects are the tolerance and the withdrawal. The harms of substance use can affect every aspect of a person's life. They include injuries while under the influence, feelings of anxiety, irritability, or depression, trouble thinking clearly, even blackouts, problems with relationship. They even spend their money on substances rather than buying the essentials, legal problems related to substance use, and loss of hope or even feeling of emptiness. And as an additional, even when they want to stop, some people may be aware that their substance use causes problems but still continue to use. They may use more than they intended or in situation where they didn't want to use. And lastly, they're in a stage of denial where they may not see that their substance use is out of control and still causing problems.
Hi everyone, my name is Yeshitsumu. Today I'm going to present on the diagnostic evaluation. So the diagnostic evaluation, they have mentioned about the measurement tools for alcohol abuse or dependence. And that included CAG questionnaire, cut annoyed guilty eye, Michigan alcohol screening test, and alcohol use disorders identification test. And the second one is measurement tools for other substances abuse and dependence. In that, CAGE, AID, and drug abuse screening tools. And the diagnostic evaluation, in that, the laboratory testing of blood, saliva, sweat, and hair for the presence of substances or metabolite. The period of effective measurement varies based on the procedure and the substance. States of a drug intoxication or withdrawal can be identified through the presence of a psychologic and behavioral symptom associated with the use of a particular substance. Additional screening and testing is recommended for the presence of other disease conditions or illness that include HIV, hepatitis, that may have resulted from risk-taking behavior or while under the influence of substances or may have resulted from the psychological effects of the substances, as in the cardiac dysrhythmia in the case of cocaine use. Thank you so much.
Hello everyone, my name is Ruth Ann Santos and I am here to present the nursing interventions. For the nursing interventions, we have the four cores. We have facilitate recognition of substance-related disorder. Second is encourage participation of family and significant others. Next is ensuring safety, and lastly, enhancing coping strategies. For facilitating recognition of substance-related disorder, we need to approach the patient in a direct, non-judgmental manner, assess the patient's level of knowledge about substance, have patient identify situations preceding substance use, discuss consequences of substance use, and reinforce desire for change. Next is encourage participation of family and significant others, provide support to family and significant others while acknowledging substance-related disorder of patient, encourage family to attend supportive and educational group meetings, have family members identify effects of substance use on family functioning, and lastly, to discuss role relationships with family that may be related to substance-seeking behavior. Third is ensuring safety. We need to monitor the patient for symptoms of substance withdrawal, provide prescribed medications as indicated for the treatment of withdrawal symptomatology, educate the patient on relationship between symptoms and substance use, monitor hydration and nutritional status, reduce level of stimulation as appropriate, and assess for presence of agitation or mood lability. Enhancing coping strategies, we need to aid in identifying triggers to use, have patient develop a list of personal strengths, help the patient develop an understanding of dependence as an illness, assist the patient in developing alternative coping strategies through participation in role-playing activities and groups, identify alternative methods of participating in social situations without resorting to use of substance, and lastly, to reinforce the need for ongoing attendance of support group meetings. The next is the community health nurse roles. For the CHN roles, we need to assist in resource finding for inpatient or outpatient program such as counseling and self-help groups. Self-help groups is also called as mutual aid groups. It supports people who are working to change their substance use. Many people participate in a self-help group at the same time that they are in formal treatment. The oldest and largest self-help organization is Alcoholics Anonymous. We also need to provide referral and information about community-based programs and activities that can aid in the maintenance of sobriety. Lastly is to assist in educating and encouraging adherence to substance therapy regimen. Provide information about medication therapy as appropriate, including known adverse effects and means of obtaining prescribed drugs as necessary. Example of this is methadone.
Hello everyone, my name is Janice Paranas, member of Team 8. I will be presenting the treatment and other management of mental health issues and concerns of those with substance abuse. The first topic that I'm going to discuss is the behavioral interventions. Psychoeducation, providing clients with clear and accurate information about mental illnesses and substance use is considered essential programming for people with concurrent disorders. Motivational interventions, appropriate to a client's stage of change, can be helpful for engagement, clarification of goals, and making progress in treatment. Self-help group facilitation. Active participation can improve abstinence from substances, medication adherence, recovery self-efficacy, and quality of life. The next one is social skills training, developing specific skills to achieve their goal for recovery. Next is the increasing healthy pleasures, diverting attention to a more meaningful activities and routines such as work and recreation. Contingency management, using incentives, disincentives to modify behavioral problems. Cognitive behavioral therapy techniques, or the CBT techniques, enhancing motivations to quit substances, teaching coping skills, improving effective emotion regulation skills, developing novel healthy activities, fostering interpersonal skills, and building drug-free relationships. Relapse prevention, used as an adjunct to other treatments, help improve substance use outcomes, particularly among those with more severe substance use and mental illness symptoms.
Services and supports. First is education. This is an essential element of recovery for people with mental health issues and addiction problems. Employment housing. This is a key determinant of health and well-being. Human rights, income. For some people with mental health issues and addiction problems, they are eligible for some tax credit. For justice, there are many services available to individuals with mental and addiction problems who come into contact with criminal justice system. Resources for accommodation and accessibility. People with mental health illness and addiction issues have legal protection from discrimination on the basis of disability in employers. Last is support for families and caregivers.
Our team also gathers some list of support group for families and caregivers. The first one is the Canadian Mental Health Association, Toronto's Family Outreach and Response Program. It offers recovery-oriented mental health support services to families. The Family Association for Mental Health Everywhere, or FAME, offers support to families where any mental illness is an issue by providing education, resources, and coping strategies. The Mood Disorders Association of Ontario and its chapters across Ontario provide a range of peer-based self-help support groups. Some groups are for the person with the mental illness alone. Others include the person with the mental illness and his or her family members. Next one is the Parents for Children's Mental Health, or the PCMH. It's dedicated to improving the lives of families and the services for child and youth mental health. PCMH links families to important networks within their communities to ensure they get the care they need and the support of families who can relate and support them. The Schizophrenia Society and its many local chapters offer self-help support groups for family members of individuals with schizophrenia. The NAMI Family to Family Education Program is a free 12-week course for family caregivers of individuals with severe mental illnesses. The last one is the Government of Canada, offers various forms of assistance for caregivers. Service Canada has established a list to help you prepare for this role. That's the end of my presentation. Thank you.
And thank you so much for watching, and that's for Team 8.